Millions of women say they feel they are finally being heard. Polycystic Ovary Syndrome is getting a new name to represent more of what this condition really entails. The new name is Polyendocrine Metabolic Ovarian Syndrome. Dr. Nita Bijoor from Oakview Medical Associates in Greenville is joining me now to explain this name change. So thank you so much for being here.
Thank you for having me.
And I saw that 50 leading academic, clinical, and patient organizations came together and decided to make this name change. Can you explain why?
This is a 14-year-long global effort to change the name from PCOS to something that's more recognizable, and so they renamed it Polyendocrine Metabolic Ovarian Syndrome, which signifies it's not just about the ovaries, but it's underlying metabolic and hormonal dysfunction that is affecting women's health. So
what should people know about this? I mean, it's pretty common, right?
It's very common. 1 in 8 women experience some form of metabolic dysfunction affecting their fertility and their health overall. And that's 170 million women worldwide. Wow. So that's pretty, and over the years, what we've seen is calling it PCOS has caused delay in care, a lot of stigma, a lot of confusion, and fragmented care, because who manages this? Is it your primary care physician? Is it your gynecologist? Is it your fertility specialist? So this puts into perspective that it's a metabolic dysfunction. Underlying cause is insulin resistance. And once you address that, then you can address each component of the metabolic health of the woman.
We have on screen here that according to the World Health Organization, 70% of individuals are undiagnosed.
Right.
And I find that just shocking.
And I see that in practice. A lot of women that, I feel have some form of insulin resistance, metabolic dysfunction, they'll say, oh, I've been checked out for that. I've had the blood work. I've been told I don't have cysts. 1 in 3 women with this condition actually don't have cysts on ultrasound.
Not about the cysts.
It's not really about the cysts. So I think now renaming it puts it into perspective. Look beyond that. Look at the symptoms. And there are some concerning red flag symptoms.
Now, you were mentioning before that there wasn't a certain doctor to manage this condition.
Right.
Is there someone that people should go to now?
So I think overall, I'm a board certified obesity specialist. So metabolic dysfunction is something I'm truly passionate about. So finding family physicians are trained, your gynecologist should be trained, but it's not a one-size-fits-all approach. It's really looking at the symptoms. Irregular periods is just one of the symptoms. Some women with PMOS have regular cycles, but then they have acne, and they have facial hair, and they have fatigue, and they have other subtle symptoms. They're not able to lose weight. So we have to look beyond just ovarian function. Some women have had no trouble having the first pregnancy, but then cannot have the second child. So they approach us in primary care, and then we look at there's no one blood test that can diagnose this. It is looking at the clinical findings. That's why it's called a syndrome, And treatments also vary from nutrition, lifestyle management. The insulin sensitizing metformin and GLP meds also help manage endocrine dysfunction. Yes.
Okay. All right. Well, thank you so much for joining us and breaking all that down. I think a lot of women were interested in that story.
Absolutely.